Welcome to Dental Sleep in 5, Episode 6. Today's topic, learn about my favorite go-to appliance. I have no vested interest in any appliance, device, or technology, maintain a sleep disorders dentistry practice, conduct research, and provide educational programs. The facility I work in is accredited by the AADSM, and our facility and all our educational programs follow AADSM guidelines. So learn about my favorite go-to appliance. The question should really be, do I have a favorite go-to appliance? And the answer to that is no. Well, actually, my favorite go-to appliance is the appliance that is best suited for the patient's needs. Thankfully, we have many good appliance designs, allowing us the ability to select the most appropriate appliance for a specific patient's need. First, assess the patient, condition and health of the dentition and periodontium, retention capabilities of the dentition, edentulous areas, size of the arch and the mouth, pre-existing TMD, range of motion issues, level and type of bruxism, existence of positional sleep apnea, manual dexterity of the patient if contemplating home calibration, severity if looking for active advancement beyond what is available passively, allergies and nasal patency issues, and Medicare status if applicable. Second, select the appliance that will best address the patient's needs. Consider the appliance design, retention mechanism, evaluate strategic teeth, attachment and propulsion mechanism, location of connectors, range of motion, the patient range of motion versus the appliance range of motion, vertical dimension opening, are you going to max out or are you looking for a minimal? Customizable options, anterior midpoint excluding stops, elastics, options for mouth breathers, PAP connectors, ease of calibration, acceptability to the patient. We need that patient buy-in if they're going to be putting it in the mouth every night. So the tongue retaining device is something not talked about often. However, there are patients that just are not suitable for mandibular advancement devices because of compromised dentition. Now, if they're CPAP intolerant, a tongue retaining device can save the day for them. With regards to cost, can be considered a false economy. There are low-end priced appliances out there that will have a limited lifespan, perhaps, can come in handy under certain circumstances. But if you're feeding somebody for an appliance for the long term, I would caution you with regards to the false economy of the lower end, lower lasting appliance as far as timeline goes. Having said that, I've heard of many cases where patients have worn one of these devices and actually gotten a very respectable length of time out of the appliance. Now, this of course is patient specific. So if I'm talking generally, that time frame is going to be a different number than if I'm talking patient specific. For hypersensitive teeth, we have appliances that come with soft liners. And then there's the lateral bruxers, appliances that are forgiving, that have either very elastic connectors or a good range of motion laterally. And then we have various options that are available for small oral cavities. Lots of tongue space. For maxillary edentulous, this can be done a number of different ways, but you do need to have retentive teeth or implants on the mandible to hold on to that jaw so it doesn't drop open. And patients that have outstanding dentistry that they don't plan on doing immediately or before they get their appliance, you need to make sure you use an appliance that you can adjust easily around the new dentistry, or if it's thermocryl lined, you can easily readapt over the new dentistry. For patients that have elevated supine apnea, they may need a way to keep that jaw closed while sleeping on their back. So you need to make sure that you add the capability to place elastics to keep that jaw closed while they're sleeping supine. And of course, some appliances by default and by design hold the jaw closed. Then, of course, if you're dealing with Medicare in the States, you have to ensure the appliance of choice is on the PDAC cleared list. And here's the information so that you can go to the appropriate website to establish that. Remember, your go-to appliance is the one best suited for the patient you're managing. Saying you have one favorite go-to appliance is so 1990s. We are simply past that. Thank you and sweet dreams.